Ever wondered why your body sometimes gives you signals you can't quite comprehend? It's because our bodies are incredibly intelligent systems that communicate with us through changes. These changes may seem subtle, but they can indicate vital information about our health and well-being. Ignoring them might lead to missed early warnings of potential health issues. That's why we're here today, to shed light on 8 body changes you should never ignore. Stay tuned as we delve into these significant body changes. First on our list is unexplained weight loss. Now, we're not talking about a pound or two lost from a busy week, but a significant drop in weight that can't be traced back to changes in your diet or exercise routine. This type of weight loss might feel like a cause for celebration, but it can be a sign of underlying health issues. For example, it could be an early indicator of diabetes, where the body can't properly absorb glucose, leading to weight loss. Or it could be a symptom of certain types of cancer, as malignant cells can alter your metabolism and cause you to lose weight. Of course, there are many other potential reasons for unexplained weight loss, and it's crucial not to jump to conclusions. But it's equally important to seek medical advice if you're seeing this change in your body. Remember, a sudden drop in weight without a change in diet or exercise should raise a red flag. Next, we have persistent fatigue. Imagine the kind of tiredness that clings to you like a shadow, no matter how much sleep you get or how many cups of coffee you drink. That's what persistent fatigue feels like. It's more than just feeling sleepy or worn out after a long day. It's a continuous state of exhaustion that can make even the simplest tasks seem daunting. Unlike regular tiredness, persistent fatigue doesn't improve with rest. It's like trying to fill a bucket with a hole at the bottom. You may be pouring in sleep and relaxation, but the energy just keeps draining out. Persistent fatigue can be a sign of various health issues such as anemia or thyroid problems. It's a signal from your body that something isn't quite right. So if you're feeling perpetually drained, don't brush it off as just being overworked. If rest doesn't seem to recharge your batteries, it might be time to consult a healthcare professional. Moving on, we have skin changes and a persistent cough. Let's talk about skin first. Our skin is like a billboard, broadcasting signals about our internal health. New moles, changes in existing ones, or even a sudden rash could be potential signs of skin cancer. So, it's crucial to keep an eye on any noticeable transformations. Now, on to persistent coughs. Unlike the temporary cough we all experience with a common cold, a persistent cough sticks around, often for weeks on end. It's your body's way of telling you that something might not be right. This could be a symptom of an underlying condition, such as lung disease, heart failure, or even something as simple as allergies. Remember, your body is constantly communicating with you. Just as you would not ignore a friend in distress, never ignore your skin's distress signals, or a cough that just won't quit. They could be the key to catching a serious health condition early. Now let's talk about changes in urination and bowel movements. These changes might seem mundane, but they can be indicators of serious health issues. You might notice an increase in the frequency of your trips to the bathroom, or experience discomfort or pain during these visits. Changes can include the presence of blood in your urine or stools, which should never be ignored. This could be a sign of various conditions, including kidney disease or even colorectal cancer. Perhaps you're finding it more difficult to control your bladder, or you're constipated more often than not. These shifts in your bathroom routine might be more than just a passing annoyance. They could be your body's way of signaling that something isn't right. Remember, it's essential to communicate these changes to a healthcare provider. They can help you understand what your body might be trying to tell you. Don't shrug off shifts in your bathroom routines. Lastly, we have unusual headaches and vision changes. An unusual headache is one that is different from your regular headaches in intensity or frequency. It may be accompanied by other symptoms like nausea, vomiting, or sensitivity to light and sound. These headaches could signal serious conditions like brain tumors or aneurysms. A brain tumor might cause a headache because it's pressing on surrounding tissue, while an aneurysm, a weakened blood vessel in the brain, could cause a sudden severe headache. Now let's talk about vision changes. You may notice blurriness, dark areas, or distorted images. These could be signs of conditions like glaucoma, which is damage to the optic nerve often caused by high eye pressure, or macular degeneration, a disease that deteriorates the central part of the retina. Remember, these symptoms should not be ignored. Don't take your headache or vision changes lightly. It might be more than just a simple strain. To wrap things up, your body is constantly communicating with you. It's like a complex, finely tuned machine, always working, always sending signals. The trick lies in understanding these signals and acting on them. We've talked about 8 significant body changes that you should never ignore. Unexplained weight loss, for instance, might be a sign of underlying health issues. Similarly, persistent fatigue can be more than just tiredness. It could indicate conditions like anemia or thyroid problems. Next, we discussed skin changes and persistent cough. While skin changes can result from aging or exposure, sudden or drastic changes warrant a deeper look. A persistent cough, on the other hand, might be your body's way of telling you that your lungs aren't functioning at their best. Changes in urination and bowel movements are other key signals. They can point towards issues with your digestive or urinary system. Then, we touched upon unusual headaches and vision changes. Both can be symptoms of neurological problems and shouldn't be taken lightly. All these changes are your body's way of waving a red flag indicating that something might be off. It's crucial to listen to these signals and seek professional help when they occur. Ignoring these signs could lead to serious health complications. Remember, your body knows when something's amiss. It's your job to listen and act accordingly. Stay healthy and take care.